Good morning to you all. I hope you didn't have too many logistical challenges to get here. I'm actually very delighted to be here today after 3 years of interruption, talking then obviously about a face-to-face event. And obviously for the reasons we all know, we couldn't do that for a couple of years. So very delighted to be able to do that again. This morning I'll give a very short introduction before we get into the substance of our conference and open house. I'm basically going to touch on 3 topics, a little bit around Nelson Labs, Sotera Health and its history, our values as guiding principles, and last but not least, the relevance of this symposium, the way I see it. Let's first get to Sotera Health, and some of you might be familiar with it, others less. But basically today the business exists out of 3 business units. The first one being Sterigenics, one of the major contract sterilizers in the world. The second one being Nordion. Nordion is the biggest supplier in the world for cobalt-60, and cobalt-60 is used for gamma sterilization. And then last but not least, Nelson Labs. Nelson Labs, both active in microbiological testing, but like us, also very much involved in extractable and leachables work. But there is more than only that. Location-wise, as you can see at the bottom of the page, Sterigenics today across the world has close to 50 facilities, over 2,000 customers. Nordion obviously is much smaller, reason being their supply is to the main gamma irradiators in the world. That's why you see here roughly 40 customers they're serving. And last but not least, Nelson with 15 locations and over 3,000 customers. If you go a little bit back into history, and actually myself, I've been close to 17 years with the company, so I saw this all happening around me. Since 2004, the company became independent and basically operated as a contract sterilizer. Both the holding as well as the operated entity operated under the name Sterigenics. That started changing between 2014 and 2016. 2014, we acquired the company Nordion. Nordion is Canadian-based. And shortly after, we did our first big acquisition in the lab space with acquiring Nelson Labs based in Salt Lake City in Utah. Relatively, I think it was 1 or 2 years later that we also acquired the Toxicon Europe activity, the location you will be visiting later this afternoon. A company very much specialized in extractable and leachables work, initially very much focused on the pharmaceutical industry, but with the evolving regulatory environment also for medical device. Medical devices became also a very big part of our activity. With these acquisitions and all these names in the middle of it, it was also time for renaming and rebranding. The 3 business units kept their name, but the holding changed its name to Sotera Health. And apart from that, as you can see, we aligned also the logo of the 3 operating entities, as well as its holding company, Sotera Health. And that's where we are today. When it comes to our values, when it comes to our mission, we consider ourselves a leading provider of mission-critical solutions to improve global health. Be it with lab testing, be it with sterilization, be it with supplying cobalt-60 for gamma sterilization. Guiding principles, our 5 company values: safety, customer focus, people, integrity, and excellence. And I also can add here that if I look at our location, because values is one thing, but obviously a value doesn't mean a lot unless you also ensure and you promote behaviors around these. And we call it on a regular basis our spot for SPICE Awards, and let me elaborate a little bit on that. First of all, SPICE, it's a slightly different order of our 5 values, but it's all about the same thing. And secondly, we want to recognize employees in our organization each time they have demonstrating something exceptional in relation to one of our 5 values. And by doing so, we try to actively promote that behavior and make it as part of our culture as much as we can. Last but not least, the relevance of our symposium. First of all, when it comes to the medical device market, as you all know, it's a very large market, and even more, very diverse, and it is also growing rapidly. It is indeed also a very complex environment, and it is also an environment where we see a lot of innovation from a product development perspective, as well as from how we can improve the functionality, leading to improvements of the treatment of the patient. And obviously innovating by using new materials. If we then look at extractable and leachables, it is multidisciplinary. We have the analytical chemistry linked with also the toxicological aspects to it. We have structural elucidation, which becomes more and more a requirement. It also requires a lot of material science knowledge, as well as a good understanding of the manufacturing processes. And as with many businesses, also in this business, the regulatory expectations continue to change and continue to be more demanding. And that's why we as Nelson Labs consider knowledge sharing as well as training a vital part of our mission. And that's also the intent of our, let's say, symposium and open house today. Before finishing up and handing over, I definitely want to thank, first of all, the people who have been preparing for this event, both the internal staff who will be giving a number of presentations, but definitely also our external guests, our external experts willing to contribute to this conference. So a real big thank you to all of you. Without further ado, I now want to hand over to Lise van der Kelen, Dr. Lise van der Kelen, who will give an introduction in everything related to safety of the medical device in relation to the patient, talking about 10993.1 to keep it simple, although that's not that simple, Lisa. Anyways, I hope you will have a good day, an informative day, and for sure talk to you later. Thank you.